Okay, so this is chapter 2 for day 3, and we're going to start off with voluntary or nonprofit agencies. Voluntary agencies are also frequently called nonprofit agencies. They are supported by donations, membership fees, fundraisers, and federal or state grants. So fundraisers, they may do a walk or a run to raise money. There's Relay for Life, which is from the American Cancer Society, in which you can also buy like luminaries to put out at nighttime in honor of someone who has had cancer. Or they may have at a bigger, larger scale, they may have a large dinner in which is like $300 a plate for somebody to attend. They provide health services at the national, state, and local levels. The Joint Commission is a voluntary or nonprofit agency. It is a U.S.-based organization that was created to ensure that patients receive the safest, highest quality care in any healthcare setting. Meeting their standards is recognized as a symbol of quality. If you have a family member who works in the healthcare field, they may talk about when DHO comes, everyone's on edge because they want to make sure they get accredited with having the DHO standard. Many states, the Joint Commission accreditation is required to receive the Medicaid reimbursement. So therefore, if an agency is not Joint Commission accredited, then therefore they are not able to receive Medicaid reimbursement for patients, which more than likely they would not accept Medicaid patients. And the Memorial Healthcare website, it says the Joint Commission on Accreditation of Healthcare Organizations will conduct unannounced surveys of Memorial Healthcare. The purpose of the survey is to evaluate the organization's compliance with nationally established commission standards. The survey results are used to determine whether the conditions under which accreditation should be awarded the organization. Joint Commission standard deals with organization quality, safety of care issues, and the safety of the environment in which care is provided. Anyone believing that their concerns about patient care and safety in the hospital have not been addressed by the hospital may contact the Joint Commission. So Memorial Hospital is accredited from the Joint Commission. Some examples are the American Cancer Society, American Heart Association, American Respiratory Disease Association, American Diabetes Association, National Mental Health Association, and Alzheimer's Association. Many have national offices as well as branch offices in the states and or local communities. So many of those organizations focus on one specific disease or group. As you can see, there was the American Diabetes Association, the American Heart Association. So they typically study the disease, and of course when you study the disease, you're able to find how to prevent it or how to better treat it or to cure it. They provide funding to encourage research directed at curing or treating the disease. And they promote public education regarding the information obtained through research. So February is Heart Health Month, and so usually the American Heart Association, they have the red dress, and they do even more education during that month to get people more aware of their heart health. The organizations provide special services to victims of the disease, such as purchasing medical equipment and supplies, providing treatment cancers, and supplying information regarding other community agencies that offer assistance. So you could go to any of those organizations and look up maybe your state and see what kind of assistance is offered to you. They also employ many healthcare workers in addition to using volunteers to provide the services. So a nonprofit agency is another place that a healthcare worker may work at. The organizational structure of a hospital or a healthcare agency. All healthcare facilities must have them. It may be complex, such as a large facility or a hospital, or simple and a smaller facilities. It always encompasses a line of authority or a chain of command. It should indicate areas of responsibility and lead to the most efficient operation of the facility. So by having an organizational structure, somebody knows who their boss is. The employee knows who their boss is and who the next boss is. So it's important to know that line of authority. There's sample charts on your page 36 and 37. 36 is of the large hospital, and then 37 is a smaller office. The lines of authority are clearly indicated. It is important for healthcare workers to identify and understand their respective positions in a given health facility organizational structure so they will know their lines of authority and understand who the immediate supervisors in charge of the work are. They must take concerns and questions to their immediate supervisor first. If they're unable to answer, then the supervisor usually takes it to the next level. Maybe if your supervisor doesn't take it to the next level, then it may be up to the employee to take it to the next level if needed. Health insurance plans. The cost of healthcare is a major concern today. The cost of healthcare is more than 17% of the gross national product. And the gross national product is the total amount of money the country's population spent on all goods and services. So we spend 17% of our money in healthcare, which is actually quite a bit. Most people rely on health insurance plans, and they are offered by several thousand insurance agencies throughout. A common one is Blue Cross Blue Shield, is one that many people know. And the premium or fee the individual pays for the insurance coverage is paid to the insurance company. So the premium is what the person pays each month in order to have that insurance. The premium is usually paid by the employee and the employer. So it's a monthly fee you pay in order to have insurance. There's also the deductible, and it's that amount that must be paid by the patient for medical services before the policy begins to pay. So the deductible could be $500, it could be $1,000, it could be $2,000 or more. So therefore, if you go to the doctors, or the hospital, you must pay the first amount the deductible is. So let's say your deductible is $2,000. You go to the hospital, and maybe it's just a quick visit to urgent care. Let's say urgent care. And the total cost is $500. So the patient would have to pay that $500 out of pocket, and insurance would not cover anything. The next time the patient went to the ER and it was a more expensive visit, it would cost $2,000. So therefore, they paid $500 of their $2,000 deductible. So the next time they go, they have to automatically pay the $1,500 of that $2,000 before the insurance will cover anything else. So therefore, the $1,500 from their ER visit and their $500 from their urgent care visit means that they met their deductible. The coinsurance requires that specific percentages of expenses are shared by the patient and the insurance company. So therefore, it may be 80-20% coinsurance. So therefore, the company or the insurance pays 80% and the patient must pay the remainder 20%. So in order to find that, how much that would be, you take the amount of the healthcare cost. So let's say the healthcare cost is $5,000. If the bill is $5,000, you would take $5,000, and if you want to see how much the patient's going to pay, you're going to take $5,000 and you're going to multiply it by 0.2. So therefore, the patient would pay $1,000. And then the insurance would pay $4,000 of that. So again, if you wanted to see how much the company would pay, you would take the $5,000 and you would multiply that by 0.8. And then again, that means that the company would pay, the insurance would pay $4,000. So that is how you find out how much either the insurance company pays or how much the patient pays, if it's the percentage like that. The copayment is a specific amount of money a patient pays for a particular service. So therefore, like every time the patient went to the doctors, they would automatically have to pay $25 no matter what, or it could be $30. So example is $20 for each physician visit, regardless of the total cost of the visit. So those terms are important, and you're going to want to learn what those terms are and understand them. Here is a YouTube video, so you'll want to go to the Google Classroom and go to the Google Slides for Chapter 2, Day 3, and make sure you watch this video. It explains the health insurance terms better for you. Most have insurance coverage through their place of employment, which is called employer-sponsored health insurance or group insurance. The premiums are paid by the employer, but in most cases, the individual also pays a percentage of the premium. So your premium can the amount you pay for your premium can be according to how much your employer wants to pay for the premium. So if your employer is paying more of your premium is going to be less. If the employer is paying less of the premium, then the employee premium will be higher. And remember, the premium is how much a person pays each month in order to have that insurance, and it's a set amount, and that does not change for the year. There's also private policies are also available for purchase. So if somebody does not have their insurance through their employee, they can purchase a private policy. So someone who may purchase private policy may be a farmer, or it could be somebody who owns their own business. There's also health maintenance organizations, and they provide a managed care plan for the delivery of healthcare services. There's a monthly fee or premium is paid for the membership, and that fee remains the same for the year. The premium, again, is paid by their employer or the individual, and it's paid per month. Care is directed toward preventive type health care and has ready access to health examinations and early treatment and detection for diseases. So in most cases, the preventive care, remember, are those the wild child visits, the wild baby visits, anything that has to do with that is a tool to help you to prevent disease. When disadvantaged, the insured is required to use only HMO affiliated healthcare providers. So therefore, you want to go in network to someone who accepts that insurance. So one disadvantage might be if you work in Detroit, then the HMO affiliated healthcare providers are probably located in Detroit and the surrounding areas. And if you live in Owasso, you may not be able to find a healthcare provider that is in your network in the Owasso area, and you would have to go to Detroit to the doctors. Or if you go out of network to a different doctor, you would have to pay more. There's preferred provider organizations. They are provided by large industries or companies to their employees. It forms a contract with certain healthcare agencies, such as a large hospital and specific doctors and dentists, to provide certain types of healthcare at reduced rates. So again, you would have to go to a healthcare agency that has that contract with your PPO in order for it to be covered. Employees are restricted to use the specific hospital and doctors, but the industry or company using the PPO can provide healthcare at lower cost, at lower rates. So by going to the healthcare agency that has that contract with your PPO, you're able to get your healthcare at a lower rate, which in most cases for people it's important. They do require a deductible and a copayment. So remember that deductible is how much the person has to pay before insurance will start paying. And then that copayment is that set amount that they have to pay when they have a visit, no matter how much the visit costs. If they use a non-affiliated provider, the PPO may require the copayments of 40 and 60%, which means the insurance company would pay 40%, and then the patient would pay 60%. There's two main governmental plans. There's Medicare and Medicaid. And we're going to be discussing both of them, but today just the Medicare. So Medicare provides health care for almost all individuals over the age of 65. So once someone turns 65, then they can get Medicare. It's also any person with a disability who has received Social Security benefits for at least 2 years. And any person with end-stage renal kidney disease. So if someone has end-stage renal disease, then they can automatically get Medicare. There's three kinds of coverage for Medicare. There's Type A, which is hospital insurance, and they provide coverage for hospital services and extended care facilities or home health care agency after hospitalization. So if someone has Type A Medicare, then when they go to the hospital, it's covered. If they have home care afterwards or at any time, then it's covered 100%. And the extended care facility would be covered as long as they meet criteria. So right now, in order for somebody to go from the hospital to an extended care facility, which would be a nursing home or a rehab facility, then they have to be in the hospital for at least, at minimum, 3 days in order for Medicare to cover their stay at the skilled nursing facility or a nursing home. So they do have criteria to meet. If someone is not in the hospital and they decide they need to go into a nursing facility or a nursing home, that would be out of pocket. The Medicare would not cover that. And it also covers hospice care. Type B is medical insurance. It covers the doctor's services, outpatient treatments, therapy, clinical laboratory services, and the individual pays a premium in order to have the Type B medical insurance. And if you have Type B, there's also a deductible for services that they must pay. So again, the deductible is how much the patient has to pay, a certain amount before the insurance will start paying for services. Medicare pays for 80% of services. The individual must pay the balance, or another insurance policy will cover it. So for an example, my grandpa, he has Medicare, and my uncle, because my uncle is my grandpa's son, and he's mentally impaired, so they both have Medicare. But my grandpa also has Blue Cross Blue Shield from when he was working prior to his retirement. So when they go to the doctors, Medicare is the primary insurance, so Medicare is always billed first. Whatever Medicare does not pay, then the office or the healthcare agency will send that remaining balance to the Blue Cross Blue Shield, and they will cover the remainder of it. So for them, in their cases, they can go to the doctors or they can go to the hospital, and it's pretty much covered 100%. Now, that's not always the case for everybody. So if an individual wants the other 20% paid that Medicare does not cover, they must have another insurance policy to cover it, or that 20% will be out-of-pocket cost. And then there's Type D, which is for some pharmaceutical expenses, which of course is your medications that are prescribed to you. There's also the Medigap policy. Medigap policy is a health insurance plan that helps pay for medical expenses not covered by Medicare. So the Medigap policies are only for those, offered to only those who have Medicare, and they help to cover that gap that the Medicare does not cover. So that's why it's Medigap policy. So it's a health insurance plan that helps pay medical expenses not covered by Medicare. The policies are offered by private insurance companies and require the enrollee to pay a premium. So remember that premium is the amount of money that is paid per month in order to have that insurance. So people who work, it's taken out of their paycheck. And I think in most cases for Medicare or Medigap policy, the premium is taken out of their Social Security checks, or it might be taken right out of their checking accounts. They must meet specific federal guidelines, so Medigap policy must meet federal guidelines. And they provide options that allow enrollees to choose how much coverage they want to purchase. So again, the more the policy covers, then the higher the premium will probably be. So here is here's a very good YouTube video, again on Medicare, and talks about it. So I would definitely watch it, explains it more. You can go to the Google Classroom and go to the Google Slides and watch that video. Sorry about that. Oh, okay. So that's it. I guess I didn't realize that was the end of it so quickly. So if you have any questions about the Medicare or health insurance plans, be sure to contact me. And that's it for today.